dPlasma. Our project is regarding clinical trials of convalescent plasma in the United States and in the world. Those trials have started, and for clinical trials to work, they need a lot of data. And the FDA already approved it, so we're going to see the story of how this is happening in the United States. It is already happening in Miami. But we thought if we need a lot of data, we're actually going to need to have a lot of donors. And to find donors, this is the hard part. So what are we building exactly, and why are we building it now? We're building an app for matching those plasma donors to patients in the convalescent plasma program requirements of any country in the planet. This is actually not for everybody yet, but the studies are showing promising results. We built a quick, reliable, and privacy-preserving matching mechanism globally that is easy to use. In our model, compatibility between blood types matter, coordination in the supply chain infrastructures matter, and the jurisdictions that those people are today do matter. Today, a person can only donate blood in its own country where they are residents. In the future, we believe that the planet is one whole globe and anybody could donate in any country of the world. And that's why we think that the blockchain comes in. Do we actually need the blockchain? The truth is that we do not. What we do have today is a model that works very well in a centralized database. But thanks to the public key to private key model, we're going to be able to encrypt the data and protect the privacy of the donors. So thanks to that, we're actually going to be able to use verifiable credentials that anybody can check the accuracy of the data. Who are our main competitors today? Well, actually the big ones. Amazon already has started projects finding to connect plasma donors and researchers. They do have the biggest infrastructure in the internet databases and data centers globally. Actually, most of the nodes of blockchains are deployed in Amazon instances. So they're a big competitor. The other one is actually Facebook, with over $605 billion market cap. And Facebook being present in 3.2 billion devices, they are considered a heavy competitor to our model. Anybody on Facebook is able already to put their private information, such as their blood type and if they're actually donors of any kind of organs. So from April 2020, over 98% of Facebook active users are actually coming from the mobile world. Thinking about the mobile world, we thought about an app built using Flutter, which is actually an app that builds for both iOS and Android. What did we build for this hackathon? We built an app, an infrastructure, and a database. This app is using the Web3 Dart library, that is the connection between Ethereum and Flutter over RPC connections, and a decentralized public key infrastructure that counts with the supply chain in New York. We actually also grabbed a lot of information from data coming from the FHIR databases in the US. So we built a Django REST framework where anybody can try to find donors via their Ethereum addresses using Django REST framework. There is a link here with a more detailed description about our app, but what matters for this presentation is actually this infrastructure that we built. The app is all connected with the logic of a smart contract. So imagine in a city where we have as New York City as our model, we're gonna have 3 donors. Each one of them already tested negative on the serological, confirming that they did produce antibodies for COVID-19. So meaning they are plasma donors or actually valid plasma donors. They are also confirming that they're not currently infected with COVID-19. Although our donors haven't been twice pregnant, so they have to double check that they are from the male gender, and they're between 18 to 60 years old, and they're not on the risk group, making them very valid donors. So here are their blood types. Keep those blood types in mind. But In our blockchain infrastructure, they can also be represented by public keys, and each person has a different public key. So on the other hand of the spectrum, we do have the patients. Most of them are already on the ventilator under very, very sick conditions, very high age. So we thought that they would be the ideal candidates of participating in the convalescent plasma program. Their families already signed a term called investigational new drug. So 2 of them are hospitalized in the NYU hospital, and 1 of them is on the Mount Sinai hospital. They are all COVID infected, and they can also be represented by public keys. Well, given the verifiable credential schemes, their doctors are going to be able to input their data and verify that they actually are in need of plasma. So what the doctors do is that they do put this information in the database of the hospital, which is in our model also being represented by public keys. In fact, all this information can be verified using the links presented on 3box. And let's suppose that our city of New York with 2 hospitals counts only with 1 hematologist, which is the person that can actually request plasma from the blood bank. So this person works in the NYU hospital in the morning and the Mount Sinai hospital in the afternoon. This hematologist is authorized to request and receive blood components to the blood bank. So again, also being represented by a public key. But given the verifiable credentials, we can actually double check if this person has a degree in biomedical sciences. So when we log in on 3box, we actually confirm that they do have a diploma from Harvard in biomedical sciences, and they graduated actually in 1980. So this person is a real hematologist. Well, when we think about blood donation and plasma donation, what we learned at school about the universal donor being the seronegative, that actually changes. For plasma, our universal donor is a blood type AB positive because they don't have the antigens and they can donate. So let's recap, and we have here our 3 donors. We do have our hematologist. Those 3 donors being A negative, A plus, and B plus are here, and they donated on our blood bank. And we do have 3 patients, 2 of them in the NYU hospital being B minus, AB plus, and 1 of them in the Mount Sinai hospital being A minus. So what the hematologist can do, he can actually request that the blood from the blood bank goes to those patients. So today, we can send the B plus donation to the B minus patient in NYU hospital. The AB plus patient, unfortunately, is not compatible with the donors that we did have today. On the Mount Sinai hospital, it's also covered because we did have an A negative donation. This process today is all manual, happening between phone calls of a blood bank and a hematologist of a hospital. What we would like is actually to make this process way quicker by not only having a manual process by receiving a phone call, but by having an app that would be able to connect them all together. So remember that the patient A plus actually dies, and not because of lack of donors. We did have a lot of donors, but because the donations on that day did not match what someone was in need. So we did have actually 3 donors, but 1 of them was not compatible. And we had A plus plasma bag that was donated in excess. Today in Canada, it is estimated that around 20% of the plasma or platelets bags donation are wasted every year. This is a lot because plasma and platelets, they only last 3 days under room temperature. So they need to be performed quickly. This is a system that actually works as first there is someone in need and then the donor gets called. So an app would act as a facilitator not only to get donors by notifying them, but also by using verifiable credentials. So thanks to the public to private key infrastructure, we can authorize only the hematologist to make that plasma bag request to the blood bank. In our smart contract, only the hematologist has access to that function. Only he can press that button. And the blood bank can verify that the signature of that person is actually corresponding to the public key of the hematologist. So the app represents the smart contract, dPlasma.sol, deployed on Rinkeby, and the app consumes an ABI.json. We believe that in the future, this can also be a step for organ donation, bone marrow, finding compatibility between people. This is actually what we care about. So who pays the bills and why? We thought about like insurance companies and blood banks are also going to benefit a lot. And we're estimating around $457,000 in saving per surviving patient. So the team, as you can see, is Dhruv, myself, Bruno, and Ivan, and here we are for any kind of questions you might have.